the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is a past guest, Dr. Matt Lambert. How are you?
I'm good. I'm good, Jared. It's good to see you here today, and actually good to, I guess, reconnect with you at Health in Vegas. Right? I guess that was probably the genesis for us getting back together.
Yeah, it was great to see you again in person. It's always these conferences when you have those in-person opportunities, which is great. And you obviously dropped some exciting news on me at the event, and we're like, hey, we need to have you back on to talk more about this.
No, I appreciate that, and appreciate the opportunity to talk about it here today. My upcoming role that I'll be taking as the lead for virtual care and healthcare innovation for the NEOM project in Saudi Arabia. And maybe for the listeners who haven't been following that, the Crown Prince MBS is very interested in future investment and post-petroleum investment, and is investing in multiple parts of their economy there in Saudi Arabia. And one of them is the NEOM project, and that deals with everything from some new tourism, building some new structures for tourism, but also a real focus on health, well-being, and biotech. So it's just a unique opportunity. We'll talk a little bit on the details about how it came about, but just really humbled and excited for this next opportunity.
Yeah, it was pretty interesting when you shared materials for me to take a look at. This seems absolutely incredible, like what they're doing with this project across the board, especially the healthcare piece. But it's really futuristic, thinking outside the box, and it looks like they're bringing on you and all these other just super bright minds that are especially in your particular area, right? Like you in healthcare, and they're bringing in the best to put this project together. So that's really exciting. How did it all come about? You taking this role?
Yeah, great question. Continuing of this really fortunate trend of just having folks ask me. I'd be remiss if I didn't mention Trenner Williams, who asked me to get into this field outside of a traditional clinical career all those years ago. And Kevin Collison, the CEO of Curation Health, who asked me to be a part of that effort there. When after New York City Health and Hospitals, we did the CMIO there. Then I went to the University of Washington. While I was there, I worked with a guy named Hani Osman. Hani is he was part of the project team there. Hani is originally Egyptian, has been involved with the NEOM project for a while, and he just reached out one day and asked me to be a part of this. So I thought it was just such a unique opportunity, and to work with people that you know and trust and worked with before. Is a part of something that I've really been fortunate in extending my career.
And what does that look like in terms of, obviously you're heading out there? What does it kind of look like for where you'll end up working? What is that structure like?
Yeah, I think the initial piece will be I'll be at the NEOM campus itself. If you have a chance to get online and go to neom.com, the site of where they're building the line, the city of the future, which is really going to be where a lot of these ideas on virtual care and future care are going to coalesce. So they have a campus there. Think of like a Silicon Valley type campus, where an incubator even might be another word for that as well. So I'll be spending a fair amount of time there. And then also, I think that when Hani and I were talking through this, we'll be spending a fair amount of time in Riyadh as well, to also to kind of project the vision and discuss the vision more broadly to the NEOM leadership around. I think there'll be some opportunities for remote work, but I think really to be there, especially early on, right? Especially in these first couple of months is going to be really key. Because I've always said healthcare technology has very little to do with healthcare and very little to do with technology, and everything to do with people and culture. And to share what I've learned around healthcare and technology with the new while learning a new culture, just seems like, again, such an exciting opportunity to make that happen. So the first at least the first 2-3 months, I imagine, heads down. Drinking from the fire hose, whatever cliche you want to put in there. I can imagine it'll be a pretty significant transition phase.
What do you think will be some of the initial challenges that you may face? Obviously, there's it's a different culture. You're in a different part of the world. Like what does it look like? Obviously, there's, like you said, the heads down challenge that is expected, but also kind of outside of that, are there things that you're anticipating?
Yeah, I've learned from again being asked to do some of these large projects, large initiatives that you really have to run in the door listening. Uh, you know, I think especially when you're talking about cross cultures to come in with too much of a with more of a I just think it's going to be very important to listen and learn about the culture and about the project up until this point before I can take a couple of months to kind of really feel how I can put my leadership imprint on what they're doing because they've been at it for a while. I think they're to the point now where you can actually start to see it a little bit. And all the the one of the really exciting things on the interview, I asked what the biggest challenges and what are the biggest opportunities we see on the project. And the answer to both questions was it's a green field. So the biggest opportunity and the biggest challenge is that you have a lot of creative freedom here to envision what healthcare, a smart city, virtual first approach might look like, and then how do you go ahead and create that? So it's just I mean one of the challenges and one of the things I'm really excited about for a change is in the U.S. market, we've to create something that drives value for patients that providers will use, that also preserves margin for the health system and for the payer. Sometimes that's a pretty narrow lane to walk, or sometimes that's a pretty small needle to thread. So the idea of being able to create something clinically first that's going to benefit patients and providers, and not be sort of wedded to the revenue model, because very often the revenue model is the biggest impedance to innovation. I've learned. So to be kind of working free from that for a while, Jared, is aside from the cultural aspects of it, the fact that to do things for clinical reasons and human centered design reasons as opposed to preserving revenue reasons is really kind of really exciting.
What's funny, as entrepreneurs, we're always taught, especially in the US, like think big.
Yeah,
And then entrepreneurs in healthcare, we still say think big. But then once it comes time to actually think big and start to put some things in motion, we go, whoa, hold up a little bit. You can't do that, or you can't do that yet. Or I don't foresee you have, like, you're truly in this role. If I had to guess, are going to be allowed to think big all the time and really define what the future of healthcare looks like, through your lens, which that sounds like a really exciting opportunity.
yeah. Well, the other expression for what you were describing was death by pilot, right? The P word, man. I do not want to hear the P word when I'm working on the NEOM project, because it's your point. A creative solution. You make a lot of investment in it. Probably getting a lot of margin pressure, right? Too. That's the other thing that I'm looking forward to. I think there'll be just kind of the long view that they seem to be taking with this project. They'll you won't get quite as much margin pressure from you like an investor community as you would here. So to be able to think big, think a little bit longer, I think is going to be really, really exciting. And again, to focus on and the other thing too is, when I was talking with a couple of the other lead clinicians, again, my job one for me is going to be virtual care, and innovation around that. But we also think about they're going to do some projects on the existing healthcare structure and the existing population, especially around genetic screening and a lot of really big data analysis on how they're going to do this. And and I'm entertaining the idea. We'll see how this lands when I get there. But of truly open algorithms, right? You get caught in this really weird paradox in some of these spaces of where to be innovative and create your AI technology, but that's also your IP, right? That's where a lot of the value is in what you're doing. And so if we can create the kind of culture and have the kind of investment where say this is what we're thinking, this is how we're going to do it, and oh by the way, here it is. To see the actual process around that is something that I think we might have the opportunity to do as well. And that's a total game changer. That is a total game changer when you're coming at this with a completely open set of how you're working your ideas.
Well, let's talk to current state U.S. healthcare through your lens.
Yeah.
Obviously, first time that we had you come on, things were a little bit different. It seems like things were actually moving very fast in the space, right? We were in what seemed like a good period. There was a lot of innovation. There were a lot of new businesses. Innovation was flourishing. The
Yep.
market looks a little bit different now than it did when we last had you on. What's your take on it? Where do you see things heading here as well?
No. So first of all, COVID, right? You can't talk about that era or the last couple of years without COVID and the influence that it had on the space. And we felt that there were so many unknowns, and people were literally adapting daily sometimes to what was happening. So there was a spirit of necessity driving invention there, right? We've kind of seems like we've retreated a little bit now post COVID world. Everyone's got a little better eye on that. We start to see some of the segment market segments retreating to kind of their regular, traditional spots. We even start to see some telehealth things maybe pulling back a little bit. Just saw something about that in the news the other day, which is unfortunate. I guess it's the nature of things, but it's unfortunate. And then the other thing that I think has created a lot of, especially a place like health, or especially when a lot of this is the startup world, the interest rates going up 5% a year. It's really hard to. Well, first of all, you feel it every time you go to the grocery store. That's for sure. But the interest rates going up that for a space that was really driven for years, for only what 10, 12 years on low cost financing. That financing increasing, along with some of the changes, especially that are coming, in Curation Health, we're all in the risk adjustment space and quality gap space. And with the changes that are coming with version 28, with CMS's, their stated goal being parity between Medicare Advantage and the ACO. I don't know anybody who's got a business plan that accounts for sometimes an 11% drop in revenue and a 5% increase in your cost to borrow money. It's 16% margin squeeze. So I think between those changes, which I think are going to drive a lot of consolidation and among some of these more niche products, and that was definitely a buzzword at Health as well, consolidation. But I think between the market getting tighter and payers and providers kind of retreating to more traditional stances post COVID, I see a pretty tough road ahead. So that's another reason, try not to ignore an obvious opportunity when it, literally shows up on your phone, to take this now, because I think there's just going to be some other innovative opportunities there in a different environment.
You talked health a little bit in there. Obviously, that wrapped up not too long ago. It was a good event. Great to see some familiar faces in
Yeah.
person. Another big kind of hot topic was General Catalyst's interest in buying a hospital system. What's your take on that?
Um, After the initial, I'll call it, well, shock might be too strong a word, but after the initial absorbing that, it's the next step. When you think about the way they view this, and the way being VC, and the way they tend to stack investments. And I think actually, that'll also help, a lot of these niche products, a lot of these point solutions. That's also going to force them to start thinking about these in more of a platform way. Again, I think the platformization of all this, I don't know why it wouldn't go that way. It seems to go that way every other time in healthcare. But I'm going to use a really bad pun here, but I think that might catalyze um, their kind of consolidation on how they do this, because there's no substitute for owning the thing from soup to nuts and operating the thing and seeing how these technologies work together and not work against one another, or don't. So as big of a change it is, I think it's the next step. It's the next progression.
Yeah, and I think what it also can
Uh,
do is it puts pressure on the other hospital system. Like they're going to see a super innovative VC firm come in and be able to move a bit faster, make some just because that's how they're used to doing things. Uh, it makes it so okay. Now it's possible for these other hospital systems to kind of follow suit and makes decisions, and I think it could be a really good thing. It'll be interesting to see how everything plays out and if also other firms have interest in doing the same thing.
yeah. Again, my only plea is, let the let the patients and the providers uh, help guide you on this, right? Trying to keep a piece of technology, so just to protect an investment, can't be the guiding principle here. It has to be how does this help us get through our day more efficiently. And I was just down at Flacco's, in Florida, their ACO conference there, and Nick Redding and I was we're on a panel just talking about health AI, and I would love to see. I think we'll see. Anything that we can do with AI to just remove some of the rote, uh, monotonous, repetitive tasks. I think that'll be. I think that's a really good use of it, and that way you can let clinicians focus on critical thinking and and bedside manner. But I also think that historically, the getting these point of care tools are the biggest challenge. That's why I think we might see a lot of this innovation might come outside of the workflow. When we think about R&D for prescriptions, or excuse me, for pharmaceuticals, or we think about matching patients with studies. I think we'll see that part progress faster. I think the slower road is going to be how do we get all of these tools into the point of care where people either are delivering care or receiving care with those tools. I still think that's going to be that'll be a bumpy road to
Yeah,
get there.
it'll be interesting to see how that plays out. Well,
Yeah,
I want to thank you so much for coming on the podcast and updating us on what's next for you. And it sounds super exciting. We'll definitely have to have you come back on, especially as things really start kicking off. And I know you're going to be, like you said, heads down for the first few months. But again, would be great to have you come back on, chat about what's happening, and always get your opinion on things happening in healthcare.
fantastic. Good to reconnect. Thanks for having me on to talk about this. Look forward to the next time. Well, maybe I'll ping you in 3 months or so, and we'll see where we are.